Good afternoon. My name is Markus Cornberg. I'm a professor for infectious diseases with a focus in viral hepatitis at Hannover Medical School, Germany. And today I will explain to you how hepatitis D is diagnosed. Hepatitis D is a relatively rare but serious liver disease caused by the hepatitis D virus HDV. However, it occurs only in individuals who are co-infected with the hepatitis B virus, as the hepatitis D virus needs the envelope of the hepatitis B virus to infect liver cells, hepatocytes, via the anti-CP receptor. Therefore, the first message is that a test for HDV, hepatitis D, only makes sense for people with hepatitis B virus infection. Now, which individuals with HBV infection who are HBs antigen positive should be tested for hepatitis D? Should all individuals with HBV infection be tested, or only those with a high probability of infection, as the infection only occurs in 3 to 5% of all HBV infected individuals? The likelihood of HDV infection varies depending on the population group. There are certainly individuals with a higher risk or higher probability to have an HDV infection. For example, there are regions in the world that have a particular high prevalence. This means that migrants from these countries or these regions in the world, especially those without an HBV vaccination program, have a higher probability to be infected with HDV. Now, looking at the map of the global prevalence of HDV infection, you can clearly appreciate that there are regions with a very high prevalence, like in Asia, in Africa, South America, where hepatitis B is also most prevalent. However, there are regional differences. For example, the prevalence is very high in Mongolia, Uzbekistan, parts of Brazil, for example, the Amazonian region. In Europe, hepatitis D is common in Romania, Moldavia. However, you can also see that there are a lot of gray areas where we have not enough data, because hepatitis D testing is not done frequently, and therefore the data on the epidemiology of hepatitis D is scarce. Now, the hepatitis D virus is mainly transmitted through blood-to-blood contact. This means that people with corresponding transmission routes are more frequently affected. For example, people who inject drugs. Co-infections with HIV and HCV are therefore also frequent due to the common transmission routes and must be ruled out. Patients with progression of liver disease and hepatocellular carcinoma are also more frequently among those with HDV infection, because chronic hepatitis D is the most severe form of viral hepatitis. In principle, however, all HBs antigen positive individuals are at risk of becoming infected with HDV. Hepatitis D can therefore affect anyone with hepatitis B. And as the screening of risk groups is always more complicated and therefore can overlook infections, there's a clear recommendation from the EASL and also the German guidelines to test all HBs antigen positive individuals for hepatitis D. Risk groups may be considered for repeated testing. Now, how is the procedure to test hepatitis D? First, the test requires a blood sample to be taken. The blood is first tested for antibodies against the hepatitis D virus. A positive result means that contact or exposure to the virus has taken place. A positive result does not mean that there is an active or chronic infection at this time. An infection can clear spontaneously, but this happens in less than 50% of the cases. So the antibody test is a good screening test. To determine active infection, however, PCR test is required. The PCR test will detect the HDV RNA, the viral genome. A positive test indicates an active infection If the test is negative, the virus cannot be detected in the blood, and most likely the virus has been eliminated. In cases of doubt, a repeat testing should be carried out, especially in those with risk factors and when there is still concern for hepatitis D virus infection. In addition to virological diagnostics, further tests should be carried out to determine the stage of liver disease. This means liver inflammation and liver fibrosis. For this purpose, liver enzymes are tested, like ALT, AST, also gamma-GT or alkaline phosphatase, and bilirubin. Now, to determine the liver function, the blood clotting is determined because coagulation factors are being produced in the liver. This is done by the quick value or the INR. Other important blood values associated with liver function and the severity of the disease are, for example, platelets or thrombocytes and albumin. A liver biopsy can be carried out to determine liver fibrosis. However, there are also non-invasive procedures, such as the FibroScan, which is shown on this figure. The device has a probe that emits an ultrasound to measure liver stiffness. This assessment is important for determining the urgency of treatment indication or whether regular screening for liver cancer is necessary in those with an advanced liver fibrosis or liver cirrhosis. Finally, I would like to briefly conclude. Early diagnosis of hepatitis D is crucial, as effective therapies are available. Therefore, all people living with HBV infection should be tested for hepatitis D. Thank you for listening.